Hi, it's Steve Small, IDD Therapy Disc Clinics. People often ask me how we treat targeted spinal segments. Here we have part of a patient lying supine on a table. With IDD therapy, we begin by patient's knees over this cushion, which we call a Toblerone cushion, to flatten the lordotic curve. We're going to use distraction and mobilization forces at specific angles so that force is directed to specific levels. So how do we treat specific levels? Well, using the IDD software, we're going to select an angle, and different angles are appropriate for different levels. So if I want to target the L4, L5 disc, I'm going to use an angle of 15 degrees. We have a belt that's going to come out, and I'm just going to show you how we raise this up. I'm going to select 15. And the decompression head is rising up to a point. Okay, from here, well, I'm going to pull this belt out and connect it to a harness. So with the patient lying down, knees bent, we're going to pull the belt out and we're going to connect that to a harness. Now, depending on the angle, this is physics and vector forces. Depending on this angle, we have what's called a point of application of the force. So the steeper the angle, the further up the spinal column the force is going to be directed. Not 100% at a particular level, but a difference of 5 degrees can make a massive difference to where the force is working and how we can open specific spinal segments. So we're going to be opening and then mobilizing. So once we have the patient in position, you have people who are different lengths, obviously, and different sizes. So depending on the height of the patient, we can adjust this angle using an inclinometer. So some clinics will use an app on their phone, and I can move this. I'm just adjusting this depending on where 15 degrees is. Okay, so with traditional traction, the motor would tend to be in a fixed spot. People would use their lifting knees up to different positions, but it wasn't precise. The treatment was kind of developed with this question of how can we precisely focus treatment at a segment, and hence you have this sort of engineering solution. Patient's very comfortable. We apply forces of half up to and over half a patient's body weight, which is considerable, and there are factors which determine why the forces are applied and comfortably, so the patient is completely relaxed throughout the treatment. They're lying on the machine for 25 minutes. There are 13 cycles of 1 minute where the joint is opened and then mobilized. We use a longitudinal mobilization when the joint is open, and that is kind of relieving tightness, stiffness in the segment, helping with mobility. So there's quite a few factors which make this different from traction that people are of old, and this kind of angling capability makes the IDD therapy much more precise than treatments of old. So if you'd like to try this treatment, go along to your nearest IDD Therapy Disc Clinic. They'll be more than happy to let you try it and experience it for yourself. That is the acid test, and I encourage you to go and see. So I'm Steve Small, IDD Therapy Disc Clinics. If you'd like some more information, get in touch and I'll be happy to share with you. Thank you.